A meniscus tear in the knee is one of the most common orthopedic injuries that exist, and it's also one of the most mistreated. So many patients are having unnecessary surgery for the meniscus. And also, so many patients are not having the surgery that they need. Here's how we make that decision.
What do you say to a patient who had a meniscectomy years ago and is now developing knee pain?
If a patient comes in and is now developing knee pain and has a history of a meniscectomy, there's a possibility that patient has now developed arthritis. Unfortunately, a lot of surgeons are potentially aggressive, for lack of a better word, or proceed with meniscectomy when sometimes a meniscus repair could be done, or proceed with resecting more meniscus than necessary. Instead of just a little unstable portion, they may take out a bigger portion. So unfortunately, that may lead to arthritis, and that's always a concern.
Is there any way to replace removed meniscus?
There are meniscal transplant procedures that can be done. The criteria is very specific. There has to be no significant arthritis. It's typically done if the entire meniscus is lost. And it would say if somebody had a bucket handle tear, young person had a bucket handle tear, and instead of a meniscus repair, they had a meniscectomy and the entire meniscus was removed at a young age. That potentially is a candidate for a meniscal transplant, because that patient needs the meniscus, because to lose the entire meniscus at a young age, the arthritis will accelerate very quickly. We can do that. Isolated spots of the meniscus that are lost, no.
What are root tears? Why are they underdiagnosed, and why do they matter?
So the meniscus is attached, just like a tree, with a root to the bone. And if we look closely, the root of the meniscus is deep in here, and you can see the fibers. They have these kind of striated fibers as opposed to the smooth remainder of the meniscus. That's the root, and that's where the meniscus actually goes into the bone, just like the root of a tree. And the blood flows and keeps it there. And that creates significant stability for the meniscus. Studies have shown when the root of the meniscus tears, arthritis sets in a very aggressively rapid pace. In the past, when MRIs were not as powerful, they were often missed. Even now, a lot of times, people get open MRIs that may not be so powerful, MRIs that are not as strong. Unfortunately, sometimes that can be missed, or the radiologist or the orthopedic surgeon may not be quite as experienced to find it. That does happen. Those things can be missed, and that's very unfortunate, because if it's missed, arthritis will potentially set in and progress very quickly. That can occur in two mechanisms, similar to the regular meniscus, and it can occur from significant trauma in younger patients. And if that's the case, it really should be fixed promptly to stop any development of arthritis or any progression of it. But it could also be one of the early signs of the beginnings of arthritis, where there's no arthritis, but all of a sudden the meniscus root pops. And just like the root of a tree, the tree needs to hold on through the roots. So if the root is torn, the whole tree, you can see, I'm sure you see after horrible storms, you can pass by in the country and you can see these trees overturned and the roots pulled out. Those roots need to get back inside that soil to nourish it. So for those patients, we can really stop the progression of arthritis if they have a meniscus root tear by fixing that root. And it's a dramatic situation, dramatic improvement.
What symptoms should make a physician specifically think about a root tear?
A sudden pop, acute sudden pop with severe pain, very often in the back of the knee, because the root is towards the back here. But unrelated to a twisting injury. So, for example, in comparison to a pop for a soccer player, for example, that has a non-pivoting, non-contact pivoting injury, they'll feel a pop. And for those patients, right away our radar comes up for ACL tears. But for patients that are a little bit older and have not had a traumatic event, say like just stepped off a curb or something, pop, that right away we think meniscus root.
What happens if a root tear is missed or untreated?
Unfortunately, arthritis may progress at a very rapid rate according to the studies. So it's very, very important to always have your radar up and be conscious of root tears.
Is this something a general orthopedist catches, or does it take a subspecialist?
I don't want to give generalities about anyone or other surgeons, but typically for someone to be able to determine, diagnose, and particularly repair a meniscus root tear, would have to be someone who's very experienced at this type of surgery.
You mentioned that repairing the meniscus at the same time as ACL reconstruction improves healing because of stem cells released during drilling. Can you explain that?
Absolutely, yeah. Just like stem cell therapy, people go and will potentially either they can get the stem cells from a donor, from fat. The most productive one is from the bone itself, where it's drawn out. People have a modification of that by using just their blood, PRP. So we have the stem cells in our body are the cells that keep us healthy and let us heal. So during ACL reconstruction, we have to drill holes in the bone itself. Those stem cells that keep us healthy and let us heal, they are produced in the bone marrow, in the center of the bone. So they're very difficult to get if you're not doing anything invasive. But during ACL reconstruction, we're already drilling holes in the femur here and the tibia here. So we're drilling holes into the actual bone. And when we drill into the bone, all the nutritious stem cells start flowing out and into the joint. So if we're repairing the meniscus at the same time, not only are we benefiting from the blood flow and the peripheral vasculature, but now we're benefiting from all the stem cells that have come out from the bone marrow. And so it's been shown that the rate of meniscus healing is dramatically higher when it's done at the same time as an ACL reconstruction, as opposed to isolated meniscal repair without an ACL reconstruction.
Is this widely known in orthopedics or more niche?
It's known by the ones who do ACL reconstructions and meniscus repairs.
What is the recovery difference between a meniscectomy and a repair?
So, a recovery from meniscectomy is actually fairly simple and relatively quick. There is no brace. There's some light bandages. We use absorbable sutures, so they fade away. And we see you 1 week after the surgery. We see you 1 month after the surgery, and then 2 months after the surgery. And usually after 6 to 8 weeks, you're fully recovered for the most part. You can bear weight right away, and it's a much easier recovery. ACL repair takes longer and it's more involved. There would be a brace. We still use absorbable sutures for just about from the majority of our surgeries. But there's a brace, and you would have to wear the brace. Usually 4 to 6 weeks is the average. Sometimes we keep it a little longer, but that's the average. We may ask you to limit your ability to bend your knee because the repair is usually towards the back of the meniscus. So if you bend your knee too far, it might interfere with the repaired tissue. So we usually limit it to around 90 degrees. We usually ask you to use crutches at least for the first 2 to 4 weeks, because if you bear weight too soon, it may interfere with the blood flow, and we want as much blood flowing to that repaired area so it will heal. And typically we see you 1 week after the surgery, then 1 month after the surgery, and we see you on a fairly regular basis. And on average, the recovery is in around 4 or 5 months to get a complete recovery to return to full pivoting sports.
Why is the longer recovery of repair worth it in the right patient?
Because it'll protect you from arthritis and preserve your joint. So if we do meniscectomy and take out a portion of your meniscus, you're not going to get that meniscus back, and that doesn't guarantee you're going to get arthritis, but it does increase your likelihood of getting arthritis. While if we repair your meniscus, even though it's a longer recovery and more cumbersome, it's in the long run, you'll be happy that you did it, because it will significantly diminish your chances of developing arthritis and allow you to function for as long as possible and preserve your joint for many, many years to come.
What does the patient do during the longer recovery that they wouldn't do after a meniscectomy?
So some of it is the brace. So we have to have the brace for approximately a month on average. And the balance, it's also the healing. So you need time for that meniscus to heal. The meniscus doesn't heal after a meniscectomy. It's a portion is removed. So it's really just more of recovery and the soft tissue healing around. But we want that meniscus to heal. So it takes some time for that meniscus to heal, to fully heal. And also it's a matter of regaining your full muscle strength. After any knee surgery, the quadriceps muscles gets weak. That's the muscles above here, above the kneecap here. After wearing a brace for a while and after more involved surgery, the quadriceps becomes even more atrophied and weaker. So it's a matter of time for healing, bracing, and regaining your strength and balance.
What does re-tear after a meniscus repair look like, and is it common?
The re-tear rate is about 15% in the studies. It gets it down significantly if it's done at the same time as the ACL reconstruction. I think it's down to like 7 or 8% in that range. If a patient has a meniscus repair and re-tears, I would strongly and young, active, and no arthritis, same indications as why we indicated it originally. So if we originally indicated the repair, then most likely we're going to indicate another attempt for repair. So if I have patients that come in that have had meniscus repairs and didn't work out for them, I tell them I wouldn't go in for the meniscectomy, because if they come in for a second opinion, they say, the surgeon I did it, they did my repair, it failed, and now he wants to do a meniscectomy. I usually say, and if I determine that they're appropriate they're indicated for the repair, I say we should try the repair again, because we want to make every effort to save that cartilage, particularly if you're young.
What do patients most commonly misunderstand about their meniscus tear?
I think what patients often don't understand is whether or not it's a degenerative tear or a meniscus tear. It seems as though and meniscus tears are so common, and unfortunately some people may take advantage of it, whatever the reasons might be. But the meniscus tears are so common, it's become almost standard that people presume you have a meniscus tear, you need surgery. And that's just not true. That's just not true. There's a lot of people can do fine without having to surgery, with just conservative treatment, and function fine. But it really depends upon a lot of things. It depends upon your age, your level of function, any level of arthritis that exists, and the location of the tear as well.
What do you wish every patient knew before their first consultation?
Don't go in there presuming you need surgery. Get all the information. You've been told that you have a meniscus tear, and you're not sure if you need surgery, come in to New York Bone and Joint Specialists. We'll talk to you, we'll evaluate you, we'll review your MRI, and discuss every single option available to you. We'll take very, very good care of you.